Yes, dear all, Dr. Vishwa from Vishwa Medical Coaching, and these are some of the very simple MCQs which we have designed after listening to our video lecture, so that it is uh, confirmed that you have seen the video lecture properly and you also understand the basics about this thing properly. There are MCQs which are much more difficult than these, but first we need to solve the MCQs which are very simple. Let's say, for example, the first one MCQ: the following receptors are there in the heart. Remember, in case of an autonomic nervous system, we all know there are sympathetic receptors and parasympathetic receptors. So in the heart, remember, we have the alpha 1 receptors which are there in the vessels, beta 1 which is there in the heart, beta 2 is there in the lungs, alpha 2 is also there in the vessels. So answer to this is beta 1. Remember, beta 1 receptors agonist is dopamine, beta 1 antagonist is your beta blockers, atenolol, propranolol, sotalol, etc. So it's a very simple MCQ of this. Second important question, that is simple response to sympathetic activation is all except. Remember, sympathetic, as we have learned in the video lecture, that it is a dog running behind you. So we have tachycardia, yes. Excessive salivation is not there. We have reduced salivation. Bronchodilation, it is yes. Urine retention is also yes. So answer to this is also B, excess salivation in response to sympathetic stimulation. Sympathetic stimulation. Third simple MCQ: beta blockers are used in. Remember, beta blockers are beta 1 blockers, which are sympatholytic drugs. Hypertension, yes, it is used very commonly. Atenolol, propranolol, sotalol is used in hypertension. Constipation, in fact, they produce constipation as a side effect. Shock, no. Asthma, also they are contraindicated in asthma, as we have listened to in a video lecture. So answer to this is A, hypertension. The fourth simple MCQ on ANS: simple symptoms of OP poisoning are all except. Remember, we have learned organophosphorus compound are anticholineesterases. That means they increase the acetylcholine activity. That means they causes more of the cholinergic, or I can say parasympathetic effects. Sleepiness, yes. Urine retention, in fact they produce excessive urination, bladder will contract. Bradycardia, yes. Meiosis is yes. So answer to this is again urine retention, B. Urine retention, B, except, right. The next one, the last one, we have myasthenia gravis affects which muscles? Smooth muscle, cardiac muscle, skeletal muscles, or all muscles. Remember, myasthenia gravis is a disorder of the acetylcholine receptors which are there in the neuromuscular junction, which is there in the skeletal muscles. So answer to this is C, skeletal muscle. It doesn't affect the smooth muscles as well as cardiac muscles. Remember, these are very simple MCQs, but we need to understand these MCQs first, and then we can go to the next complicated MCQs. Thank you very much.